Today we will learn about Chikungunya, a viral infection. Chikungunya is a viral disease transmitted to humans through the bite of infected mosquitoes, primarily Aedes aegypti and Aedes albopictus. It is characterized by sudden onset fever and severe joint pain, though other symptoms may also be present. The disease has seen outbreaks in various regions including Africa, Asia and Americas, and its symptoms can significantly impact quality of life, though it is rarely fatal. Chikungunya is caused by the Chikungunya virus, an RNA virus belonging to the Togaviridae family. The virus is primarily spread through the bite of infected mosquitoes, particularly during the day when the mosquitoes are most active. Humans are the main reservoir of the virus during outbreaks. The incubation period for chikungunya is typically 3 to 7 days after a mosquito bite, and the disease symptoms can last from days to weeks. The key clinical features include sudden onset of high fever, often exceeding 39 degrees centigrade, lasting for a few days. Severe joint pain affecting multiple joints, typically in the wrists, finger, knees, and ankles. Joint pain can persist for weeks or even months after recovery. Headache and muscle pain, fatigue and malaise. Skin rash, a maculopapular rash that may appear on the trunk, limbs, or face. Nausea and vomiting. Most patients recover within a week, but joint pain and stiffness can persist for months, in some cases leading to chronic arthritis. While complications from chikungunya are rare, they can occur, especially in high-risk groups such as newborns, elderly individuals, and those with pre-existing medical conditions. Common complications include chronic joint pain, long-lasting arthritis, particularly in older patients, neurological complications such as meningoencephalitis, Guillain-Barré syndrome, and seizures, cardiovascular issues, myocarditis, pericarditis, or heart failure in severe cases, ocular complications such as uveitis and retinitis. Severe complications are more likely in individuals with comorbid conditions like diabetes, hypertension, or cardiovascular disease. There is no specific antiviral treatment for chikungunya, and management primarily focuses on alleviating symptoms. The key elements of management include rest and hydration. Adequate rest and fluid intake are important to manage fever and dehydration. Pain relief. Non-steroidal anti-inflammatory drugs like ibuprofen or paracetamol are commonly used to relieve joint pain and fever. Joint care. Physical therapy and exercises may be recommended to manage persistent joint pain and stiffness. Prevention of mosquito bites. Vector control and protection against mosquito bites using repellents, wearing long sleeves, and using mosquito nets are critical for preventing the spread of the virus. While most patients recover fully, some may need long-term follow-up care for joint pain. Prevention of mosquito bites is the most effective way to control the spread of chikungunya, especially in areas prone to outbreaks. I hope this brief content about chikungunya is beneficial. If you like it, leave a thumbs up, share with your friends and colleagues. Your suggestions will help to improve my work. Thanks a lot.